Like and subscribe and click the bell icon to get new video updates.
How a koala colony affected by chlamydia and at immediate risk of local extinction was revived. A koala colony in Brisbane on the brink of collapse has not only recovered but more than doubled through a painstaking new way of managing the endangered species. When University of Queensland, UQ, researchers started the project in 2019, chlamydia was rampant and had infected 60% of the colony. There was just one healthy breeding female across the 95-hectare Belmont Hill Reserve. The population was crashing, head researcher Sean FitzGibbon said. Now, we've got numerous females that are reproducing. And there is now the likelihood that the colony will exist long into the future. Dr FitzGibbon led a team of 3, including 2 ecologists and a wildlife vet, to develop the new management approach. They hope to roll it out to at least a dozen colonies in steep decline, but the approach is costly and time-consuming. What are they doing differently to save koalas? Dr FitzGibbon said while a huge amount of time, money and effort went into treating sick koalas around Australia, efforts were largely fingers crossed, opportunistic and ad hoc. For example, usually a member of the public would call in a sick or injured animal. It is then treated at a hospital and released back into the wild, where there was a high level of disease. Really, what have we achieved in doing that? Dr FitzGibbon said. Their prospects of getting infected with chlamydia hasn't changed. The UQ team, funded by Brisbane City Council, took what they believed to be the first systematic approach to wiping out the sexually transmitted infection and reviving the population. First, they took weeks searching every tree, craning their necks for at least 15 minutes on each one. When a koala was found, it was fitted with a GPS tracker and vet Amber Gillett gave each a health assessment in the bushland. 13 koalas were assessed. 5 were healthy and released, 6 were euthanased and 2 were taken to hospital and released back about 2 months later. Some of them needed to be euthanased straight away. They were even having trouble climbing down a tree, they were so unwell, Dr Gillett said. Unfortunately, that is the chlamydial disease's story for koalas. No matter what treatment you throw at them, you cannot reverse the disease process. It is pretty nasty. Despite the colony plummeting to just 7 since the program's start, with successful breeding in the wild, and the injection of 4 healthy koalas rescued from other areas, the population has reached 15. Although it looks like you have a drop in growth, the overall output has increased, Dr Gillett said. The population has potentially doubled in 2 years. Over 1 to 2 generations of breeding, you start to get an acceleration, as you don't have those infertile animals impeding the population growth. We don't want to claim we've wiped chlamydia out entirely, but we may have. There is always the possibility that there is another koala out there that we haven't found. Where else would this be successful? The Belmont Hill Reserve is almost a closed colony, hemmed in by suburbia, a motorway and a busy thoroughfare. Dr FitzGibbon said their project would work in other populations that were similarly closed off, therefore almost negating the risk that chlamydia would be reintroduced. The program would not be successful in a sprawling national park. The research also examines if there are areas in the reserve that the koalas gravitate to, even when they cross roads, and a koala's travelling range and therefore how much bushland would be needed to sustain one. Brisbane City Council invested about $500,000 into the 4 years of research running until 2023. To do it across Brisbane alone, Dr FitzGibbon said it would cost millions of dollars, because it is just so time-consuming. We're calling on the Queensland Government and local councils to work together to get koala survey teams to go out and do this and take a more strategic approach to treating sick koalas and conserving populations, he said. Dr Gillett said it was normal for ecologists survey koalas, but having a vet do on-site assessments was one of the keys to the program's success. We can detect disease, even at low levels, she said. While some koalas just harbor the bacteria and transmit it, a large proportion can get conjunctivitis and become blind. Others get painful bladder infections and constantly dribble urine, or the bacteria can spread to the kidney and reproductive tract, leading to infertility. Will governments put in? Federal Environment Minister Susan Ley said there were a number of grants that will become available in coming months to improve koala health and the practical application of research outcomes. While not a part of this research, we will closely monitor the findings and are always open to considering new approaches that maximize